Your reproductive organs don't just live in a vacuum isolated away from the rest of your body, of course. Now, I'm in practitioner groups where we share different patient and client cases. We share them for feedback. Now, one practitioner presented a case in a particular group I'm in, and I was shocked how many of my peers absolutely missed the obvious probable causes. It's almost like we're trained in our holistic training even to have blinders on to what our current medical system can do to people with their treatments. It's as if this is like an unspoken rule to not touch or talk about conventional medicine. If we are to be taken seriously in the medical world, we don't want to be painted as quacks, of course, but truthfully, some of these things have very real adverse effects and long-term consequences, some of these treatments. So let me share the case. One particular doctor, she was seeking guidance for a patient who was having severe gastrointestinal issues like diarrhea, but alternating with severe constipation. And then she was having gas and pain and severe abdominal pain. And the patient had an x-ray done. She shared that x-ray, and you could see that the gallbladder was loaded with stones, even on an x-ray, which in many cases an x-ray won't even confirm gallstones unless they've been really calcified. So on that x-ray, I noticed faintly an IUD. And I'll put up an x-ray here, but this is not actually the patient's x-ray, just FYI. This is just something you can easily see on Google, how IUDs show up on an x-ray. But I was taken back by the feedback from these other seasoned practitioners. Not one of them, and there were tons and tons of comments, not one of them mentioned the IUD. Now, with severe GI complaints, the IUD must be considered as a possible cause. Only supplements, dietary changes, elimination diets, further testing, all of these were recommended by the practitioners. One even recommended looking into a low oxalate diet and even looking into mold toxicity. I was absolutely flabbergasted. So I gave my feedback. I suggested that the IUD needs to be considered. And then one practitioner strangely told me that I should not be judgmental towards the choice of her birth control, the IUD. And I felt like I was in the twilight zone. Like, as a practitioner, it is our job to tell the person seeking help and seeking guidance the truth as best as we know it. And we know that IUDs can cause all kinds of abdominal issues for people. Now, I'm not saying it causes all of them, but it has to be ruled out as a possible cause. But in this case, in the functional medicine world, we often are looking for what the patient can take supplementally. What can we give them in the form of a supplement or an herb, or what food can they eat, or what food can they restrict to help remedy their issues. While those things may be important, while they are useful in many cases, we can't just miss the bigger pieces, like a very obvious burden to the body if someone is complaining of very severe symptoms. To me, this is what conventional medicine does. It gives you a pill for every ill. It gives you something to take if you have any kind of symptoms. And as holistic practitioners, we're supposed to not function in the same way. Hi guys, if you are enjoying this video, please hit that subscribe button so we can get this information out to more and more people who need it. Also, if you can, click that little bell icon so you are notified every time we have a release of a new episode. Now, IUDs are not only a chemical stressor, but it's also a physical stressor as well. It can drastically affect the physiology of a woman. I mean, after all, you're implanting a foreign device into the uterus. Nobody's noticing that in this group. Nobody's talking about that in the entire group of practitioners with all these comments that I saw. All they were talking about is, again, what can you do to tweak the diet? Hey, are you taking supplements to help with bile formation? And they're just talking about selling a couple tests, selling a bunch of supplements, first and foremost. I mean, seriously, someone bangs their finger, you have a hammer in the other hand, or they have a hammer in their hand, you want to look at, well, maybe the hammer contributed to why their finger is the way it's showing up. So it's the same with any very physical stressor to the body. We need to rule that out if you're having associated effects from it or possible associated effects from it. So the IUD is a concern for multiple reasons. But again, with these symptoms, it's very much so one. For some women, they lose their cycles completely. Some women have very severe bleeding and extremely heavy periods. And that's not even to include the severe pain that some women experience when the IUD is initially placed. And you can go online and see thousands of women talking about this. And interestingly enough, a lot of medical doctors, most medical doctors, don't even talk about how painful that experience is, and they often dismiss it. Depending on the type of IUD, these influences, of course, are going to vary because the IUDs are different. But think about it this way. These devices are claimed to be just a little bit of progestin or just a little bit of copper. But listen, it's enough to actually stop our biological functions. If it's enough to stop reproduction, why is it not enough to impact your systemic health? Your reproductive organs don't just live in a vacuum isolated away from the rest of your body, of course. Female sex hormones influence bile secretion and your motility complex. Estrogens appear to increase biliary cholesterol saturation, so that's the main ingredient for gallstones, while increased progesterone or reduced clearance of these hormones, even in their own research, may reduce the contraction of the gallbladder. So this is partly why women can more easily experience gallstones during pregnancy or shortly after. So it absolutely can and will alter GI function. It just depends on to what extent for certain women. So the procedure is very often an excruciating one, as I mentioned. Many women will scream and cry, and some even will faint. Women insist it's the worst pain they've ever experienced in some cases. So this is not some insignificant, no big deal procedure. They don't want you to drive home after by yourself. They admit that you can have irregular bleeding for a period of time or that your periods will completely stop. They tell women that they can have pretty severe cramping for some days. I've had patients experience all of this and more. If a woman is having completely disturbed bowel function though, and gallbladder issues, recurring pain, then a valid approach would be to maybe take out the IUD first, or at least examine how it's placed or if it may be causing issues. In the United States, women have access to 5 different types of IUDs. One contains copper and the other 4 release progestin. The current IUDs do appear much safer than the IUDs we had in the past, so that's good news. I will give credit to that. They certainly have come far from the Dalk and Shield days of the 1970s, where thousands of women were harmed and over 400,000 people were in lawsuits at the time, and they paid out nearly $3 billion by the time it closed in April 2000. But are the current ones without risks or side effects? All treatments, we know this, have these considerations, and they should be looked at with caution anytime you're using any kind of treatment, and especially IUDs. After all, again, we're suppressing one of the body's most fundamental biological urges. So what are these risks? So the first risk I'll talk about is perforation. So this means that it actually busts through the wall of your uterus, and this can lead to damaged organs, infertility, emergency surgery. The risk of this is about 1 in every 1,000 IUDs placed, according to medical literature. I suspect it might be higher than that because I think it's underreported. Now, another risk is expulsion. This is when the IUD is literally kicked out of your uterus, and the risk of this is about 3 to 10% according to the literature. Now, how about an increased cancer risk? In a recent study out of the New England Journal of Medicine, they followed 1.8 million women in Denmark aged 15 to 49, and they found that hormonal contraceptives, including the pill and IUDs, were associated with an increased risk of breast cancer. What's more is it seemed like that risk doesn't just dissipate after you stop the birth control. They believe that there is long-term elevated risk. And you can see this with post-birth control syndrome. There are long-term side effects associated with using hormonal birth control. How about increased risk for depression and anxiety? Some women will notice lower mood, or even they'll start getting severe panic attacks after they get the IUD placed. Gynecologists will almost always dismiss this and will offer antidepressants, anti-anxiety medication as the solution. However, studies have shown that young women who use hormonal contraceptives, including the IUD, have 3 times the risk of suicide compared to women who have never used it. A study published in the American Journal of Psychiatry tracked nearly 500,000 women in Denmark for about 8 years. The researchers found the risk of attempting suicide was nearly twice as high for women taking hormonal birth control compared to those who didn't. The risk of committing suicide was more than 3 times as great. The researchers added that adolescent women experienced the greatest relative risk. In another Danish study, supposedly one of the higher quality studies, they looked at women 15 to 34 and excluded those with pre-existing psychiatric conditions. They found that all forms of hormonal contraceptive were associated with an increased risk of developing depression, with higher risks associated with progesterone-only forms, including the IUD. And as a medical doctor at Harvard pointed out in this study that I just referenced, she said that these findings come as quite the surprise because traditionally, Physicians have been taught that IUD only acts locally and has no effects on the rest of the body. Clearly, she said, this is not accurate. Well, of course, nothing acts only locally. Your body works in an interconnected way. How about gut issues? Our gut, microbiome, and hormones are all major players, of course, in our overall health. They influence each other. So there are very real gut manifestations associated with these types of birth control. Women will often get wrongly diagnosed with candida, SIBO, or even irritable bowel, when at least in some of these cases, the IUD or the birth control can be a major contributor. How about issues with fertility after removal of the IUD? In a 2020 review, they write that while the current literature on return to fertility after use of IUD shows that 70 to 75% of women conceive within 1 year of removal, but it also indicates that the rate of infertility after IUD removal may be double the commonly quoted rate of infertility in the general population. Another risk is an apparent increase in autoimmune conditions. This 2017 review of the literature had this to say about it. They write that there is good evidence that hormonal contraceptive use is associated with an increased risk of several serious autoimmune diseases such as Crohn's disease, lupus, interstitial cystitis, and several other rarer autoimmune diseases. People contemplating the use of hormonal contraceptives should be informed of these risks. Okay, what about the so-called non-hormonal IUDs? Well, the non-hormonal IUDs, such as the copper one, have very real hormonal impacts. The copper IUD is called the Paragard. The idea is that it relies on copper toxicity to prevent fertilization and implantation. Because of this, it's the only IUD that can be used as an emergency contraceptive. Research has shown that placing the copper IUD within 120 hours of unprotected sex had a less than 0.1% pregnancy rate, so it's highly effective. So what about copper toxicity? There have been studies showing women with a copper IUD do have higher blood levels of copper. But it's still not clear if these levels seen in the blood are true copper toxicity with associated effects over time. So I'm not so sure. I can't be clear on if copper toxicity is the issue for why some of these manifestations happen for women, or if it's the toxicity from the plastic and other materials used in the device, such as the polyethylene or the polypropylene. I suspect it can be both possibly. But regardless, if it's due to copper or the entire device itself and the toxicity of it, or the fact that it's just a foreign device sitting in your uterus, the research shows that this device works by simply increasing the inflammatory response in the uterus so pregnancy doesn't take place. Now, take it from an OBGYN who does this procedure every single day. Listen carefully as she tells us it works by creating inflammation.
How do they work differently?
So copper just makes a tremendous inflammatory reaction, which is, cover your ears, hostile to the sperm.
Okay, hostile to the sperm.
Hostile to the sperm, and just prevents implantation is its main reason. Okay. And the other one works by changing the mucus a little bit and making the lining of the uterus super thin.
The copper IUD has also been linked to changes in the vaginal microbiome, and just as the gynecologist in the video I just referenced, the inflammatory cascade is set off in the pelvis. As the study also points out, they write that our randomized data confirm that observation of others that suggests that the copper IUD may disrupt vaginal health and may put users at risk for vaginal dysbiosis. And our results add novelty by suggesting community level and inflammatory marker shifts also occur in addition to increases in total bacterial load. So this makes sense, right? This makes sense why this would happen. To place a plastic, metal, foreign device into the pelvis, the body's going to seek to try to remove it or degrade it via the inflammatory response, and microbes are a part of that job. So you're going to see a whole change in your microbiome. So as I mentioned, many patients and many women get dismissed by their doctors with some of these issues that come up, and some of them have turned to litigation. Thousands of lawsuits have been filed against Bayer regarding complications associated with the IUDs. For example, many women are claiming that the Mirena caused them neurological issues. In April 2018, Bayer signed an agreement to settle approximately 4,000 Mirena lawsuits. This settlement related to claims of perforations caused by the IUD. Now finally, circling back to the original case that I was discussing at the beginning of this video, the woman who had pelvic pain and gut symptoms. Now, I'm disappointed that we as so-called holistic doctors or holistic practitioners, we go and we look for supplements first. We go and we jump to a restrictive diet or the next test, the next functional medicine test that they can take. But we don't really look at very clear physical disturbances that can very much impact our neurology, impact hormones, and our overall health. Despite the prevalent assumption that IUDs are just minor interventions, they can profoundly disturb bowel function. They can affect your gallbladder health. They can affect your entire GI tract. And women should know that their symptoms could be caused by their IUDs, and they need to be really, really informed by that. There are many other non-hormone or natural options to manage your reproduction and fertility, which I think women should know more about. Options like, of course, barrier methods, which everyone knows about, like condoms. But my preferred method is fertility awareness method, also known as FAM or FAM, or natural planning, natural family planning. It helps you predict the signs of your own ovulation based on the language of your body, and this is very, very critical. It also gets a woman in tune with her body very directly, and it's incredibly empowering, which I think a lot of that is missed with some of these, medical ways of managing your fertility. There are several methods in this approach, but the most effective seems to be the symptothermal method. When used correctly, this has been shown to have a first-year pregnancy rate of about 1.8 per 100 women. That means about 1.8 women or 2 women became pregnant out of 100 of those who use this method appropriately. This method is based on changes in your cervical secretions, your basal body temperature, and intercourse is avoided, or a barrier method such as condoms is used during certain periods. So now if you want assistance, if that sounds like too much, if you want assistance in tracking, you can use technology like the Daisy fertility monitor, or there are several others now on the market. It'll track your patterns over a few cycles, and it'll get to know you, and it'll assist you in knowing when it's safe to have intercourse and to lower your chances of getting pregnant if you don't want to be. Many doctors dismiss this method, claiming that women can't understand their own bodies, they can't successfully use the method properly. This is simply not true. This is the only method I have used successfully, and I know many others as well. Unfortunately, conventional doctors are part of a system that dismiss women a lot, and they have many fundamental misunderstandings of the body. So what you choose to do with your body, what you choose to do with your reproduction is always your decision. No judgment from me. My hope is that whatever you choose, you do so while being informed and you understand the risks in a very real way. And you understand if you're having some of these severe symptoms, you might need to look at removing the IUD or looking at if it's causing any type of issue, and to understand that it can cause these issues.